So I'll be talking about detecting and treating depression today. So a bit about me. I'm actually a senior consultant and the head of psychiatry in Sengkang General Hospital. We are part of the Sing Health group. So I spent most of my training in Singapore General Hospital since 2009. Prior to that, I was in the Institute of Mental Health. Right now, I've been in the Sengkang General Hospital for the past 5 years. I'm very lucky to be there to set up the department. So I managed to hire a group of very dedicated doctors to join my team. And it's really a wonderful place to work in. I also did my overseas attachment at Stanford University in the Stanford Hospital. So I was there, I was in the children's department, and I have a special interest in eating disorders. So today I'll be talking a bit about depression. So I think that overall, in terms of mental condition, you can look at it in these three aspects. They are categorized either to the mad, the sad, the bad. Although I don't think we can use the word mad or bad these days. But this is a very old school way of categorizing mental conditions. So under the sad, we have the mood disorder, including depression, anxiety, and OCD. So that's what we're going to talk about today. So as all of you would know, actually things has been very stressful in the past 1 to 2 years. Especially in the past few weeks, we noticed that actually the number of transmitted cases have been going up, right? I'm sure a lot of us have been paying attention, and just yesterday there were 500 over cases. And then in the back of our mind, we are probably thinking, are there going to be more restrictions coming up or not? It does affect our mental well-being. And in the press, there have been a series of articles on how everybody's mental health has been affected during this time of pandemic. For instance, there is this article about MOE teachers talking about burnout, Singapore students talking about the stress that they face in school, about FOMO. So a lot of these restrictions that are happening right now during the pandemic are actually counterproductive to our mental well-being. A lot of this requires us to be isolated, require us to be staying at home a lot, requiring us to be disconnected. So these are not not the things that can help us manage our mental resilience. So these are some of the things that might pop up in your mind every time there are new restrictions or there are new recommendations to reduce the spread of COVID. They will always tell us that, the older folks, please stay at home, limit your visits to your parents, don't go out as far as possible. Or sometimes you will get this message that you are back to home-based learning, or some of those of us who have relatives overseas, we can't even visit our overseas family, right? So there are all these restrictions that are going on, and all these things that keep popping up into our mind that can really affect our mental resilience. So how prominent are psychological conditions in Singapore? Now, this is the study done by Institute of Mental Health that surveyed the population. So as you can see, actually in 2016, the prevalence of depression is about 6.3%. That means out of 100 people, 6.3 of us will get depression. This is pre-pandemic. So during the pandemic times, these statistics might even have crept up. So actually depression has been known for hundreds and thousands of years already. Even back in the ancient times, Hippocrates already talked about depression. He described it as an aversion to food, feeling despondent, having sleeplessness, irritability, and restlessness. So this is thousands of years ago, depression was really recognized. Now, back in the past, there are different theories on why people have depression. So in the ancient days, they talk about how it was imbalance in the blood, in the bowel, in the phlegm. And this is the picture of an ancient, not ancient, but an asylum in the olden days. Then about 100 years ago, we have the psychotherapies, like Freud and his later contemporaries talking about why people develop depression. So some of the reasons they gave were like how we may not be close enough to our parents, or we suffered some adversity when we were young. So these are some of the theories that were put forth. Now today, the psychological conditions have taken a more scientific slant. We start to recognize that actually it is beyond that of just how we relate to our parents. It has become a lot more scientific in today's day and age. So these are some of the risk factors that predispose people to depression. Like for instance, there is a higher risk in younger people. It's also more prevalent in female compared to male. So women are more likely to get depression compared to men. And there is a genetic component to it as well of around 40%. So if our parents or grandparents or relatives have depression, then the chance of us developing depression is also higher. You also tend to affect people in the lower social economic group. So people who are in a disadvantaged social situation, like they are financially stressed, they are in debts, they are finding it hard to make ends meet. These people are at higher risk of depression as well. So there's often this misconception that I'm depressed because something happened to me. Now I have a lot of patients who come to me where they cannot even identify any significant event. Like they may tell me that everything has been going so well, their family members love them, their jobs are doing okay, or they're not encountering any very specific stressful events. So it's not true that if we have depression, it's because of the stress that we are facing, like marital problems. These can be triggers, but they are not the cause of it. So let's say I have depression and I have an occupation problem. It doesn't mean I quit my job, I will recover from my depression. So the job may merely trigger the depression. It doesn't cause the depression. So these are our DNA, a microscopic view of our cells, of our DNA, and these are the chromosomes, and they realize that some of this DNA actually contributes to higher risk of depression. These are other medical conditions that can increase our risk of having depression. So sometimes when my patients come to my clinic, actually I'll do some blood tests just to make sure that it is not something else that's making the depression worse or causing the depression. So one of the very common tests I will order is actually a thyroid function test. The thyroid is a gland, a hormone, hormone producing organ in our neck. So it often affects women more than men. So if a woman comes to me and they have other symptoms, like they also feel cold or they feel hot, then sometimes I'll order a thyroid function test. And I've picked up a few cases where the depression was actually attributed to the thyroid disorder. These are some brain imaging to show changes in the brain after a person gets depression. So if you look at the front part of the brain, there's actually reduced blood flow in the front part of the brain when someone has depression. So again, this dispels the myth that someone gets depression just because they are not mentally resilient. So really, biologically, even in the brain, we will see changes when the person is having depression. Now, on a cellular level, if you look at the cells in our brain, these are the nerve cells in our brain. The scientists have discovered that actually there is a lack of brain messenger, usually the one called serotonin or noradrenaline. Now, when these brain messengers are lacking, it also increases our chance of having a low mood and anxiety. So in treatment, often we target these brain messengers that are used to communicate, that brain cells use to communicate. So I've talked briefly about what are the causes and what are the things that can trigger depression. So how do we know someone suffers from depression and it is not just the normal stress? When a patient comes to see me, I'll be looking at the symptoms that the person has. So they need to satisfy 5 out of 9 symptoms before we can diagnose the person with depression. So that's the first criteria. They must have 5 out of 9 symptoms. So the symptoms are listed here, things like poor sleep, poor appetite, low mood, poor concentration. They also often feel a change in the activity level, like they don't want to leave the house, they will do everything more slowly, excessive guilt or feelings that they are worthless, low energy. Now, in some cases, they may also develop suicidal thinking. These are more, we will take patients with suicidal thoughts more seriously, especially when they have very concrete plans of ending their life. For instance, they can tell me when and how and what time. Then in such a situation, we are definitely more on red alert. So it's quite hard to just rattle off a series of symptoms and expect our viewer to really understand what depression is about. So actually, I got this video from the YouTube, and it is by NCSS. It was a patient that was very forthcoming with his condition. So let's take a look at this video right now.
I'm Joseph Wong. I have depression. I lost interest in everything. I kept to myself. I kept away from friends. I don't feel like going out. Life becomes meaningless. With my wife realizing that, she brought me to the doctor. My wife would take 2 to 3 hours a day in traveling time to visit me in the hospital. She will encourage me to take up games, do exercise, the treadmill, play ping pong with me. She wanted me to get well. I finally realized that I should open up, and having opened up, you sort of see a life light at the end of a tunnel, like, which is good feeling. For me now, I say mental illness is the same like you having a headache. Okay, if you take that way, you have to take a medicine. Don't tell him or her, snap out of it. That is the worst. But the right thing to do is support. That's all. I hope that it won't happen again. But if it happen again, I still feel that she will still support me. That is what my wife is. And for that, darling, thank you very much for all the support you give me. I love you so much. Thank you, darling. The years and bearing with me. I love you.
Okay, so that was a very touching, I hope you find that a very touching video. It really illustrates what depression is about. He also talked about how depression is no different from any other medical condition, and we need to seek treatment from a doctor and get medication, go for therapy. He also talked about how not to say things like just step out of it, be strong. These are really not helpful for people who are suffering from depression. So depression actually has a few types. I will not go into details today, but actually sometimes they are not always the same. So sometimes we see them after a person has given birth. Most of the time it's just postnatal blues, but sometimes it becomes very severe and the mother can get very depressed and start to develop those feelings of guilt, lose interest in everything. So sometimes it can become a very serious medical condition as well. Then there are some cases of depression where they simply stop talking and they even stop eating. These are cases that generally require admission to the hospital. Some people with depression develop psychotic symptoms. Psychotic symptoms are like they start to hear voices, usually voices telling them that they are useless or they are worthless. And sometimes they might even feel like part of their body rotting. So recently I have a patient who tells me that his stomach has stopped to function already. So no matter what we tell him, or we even get the stomach doctor to come and see him, he still thinks that his stomach has become faulty. So that is a psychotic symptom. There are some patients with atypical depression. So rather than sleeping less, eating less, they actually sleep more and eat more. It tends to happen more in teenagers. So this is this is actually a poster I saw in Buona Vista MRT many years ago, I think around 2008 or 2007. So I took a photo of that. These are my shoes that you are seeing. So I took it with my handphone. These are before the iPhone days. So I thought it was quite smart because if a person is depressed, they are likely to be looking down rather than looking ahead. Right? So they actually paste this poster on the floor and where you can get help. These are the other posters located at Buona Vista MRT. They were printed by IMH, and again, I snapped a photo of them. So they are saying things like, oh, the husband lost interest in things. The other poster talk about having insomnia. So all these are symptoms of depression. Now, not every patient or not everybody who come and see me telling me they are feeling sad means they are depression. Sometimes there are other conditions as well. For instance, if someone is facing a lot of stress, for instance, like they are having a lot of difficulties at work, or they're undergoing a very strained relationship with their spouse, or they're having a lot of financial difficulties and they're feeling sad, that is normal. So also we don't call that depression. It could just be a normal reaction to stress. Then there are some cases where they do have a bit more symptoms, but it doesn't meet all the symptoms of depression, then we call it adjustment disorder. Now, dysthymia is prolonged low mood. Prolonged low mood over at least about 2 years, but not as severe as depression. They generally just feel like life has very little meaning. They can still work, but they just feel like their mood is a bit off. Sometimes the depression can also be due to other medical condition, other psychological condition, bipolar disorder. So in bipolar disorder, they will have, most of the time they are feeling down, but there are some times when their mood is very high. So high that they feel like they have special powers, or they can talk to God, or they want to spend a lot of money, they don't need to sleep at all. Yeah, so in people with bipolar disorder, they will fluctuate between the two extremes. Either they are very sad or they are very happy, very, 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 very happy. Yeah, so if you give them a scale of 0 to 10, right, they'll tell you sometimes it's a 0, sometimes it's a 20 upon 10. Sometimes people with chronic low mood can also be due to some types of personality disorder. So it's not so much depression, but rather their personality is just more morose, or they are more sullen in nature, or they tend to see things in more black and white ways. So there is this number 90%. Let's give you some time to guess what this means. What does 90% means? So there was a survey done a few years ago that found that 90% of people actually believe that people with mental illness can get better if they want to. So they don't need to do anything. They can basically just get better on their own. Again, there is this stigma that people who are weak get mental illness. No, now that's rubbish. I mean, anybody can get it, no matter whether you are rich or poor, or whatever educational status you have. Anybody can get depression. And it is a medical condition, not something that we can just snap out of it. So again, this is a survey that was done in 2017. This is lifted from the local newspaper. You talk about stigma when it comes to people with mental illness. However, that is getting better. If you look at the numbers, you see at least 8 in 10 feels that people with psychological conditions should be part of the community, and 9 in 10 felt that we need to take a more tolerant attitude. However, you also see that 5 in 10 are not willing to live with anybody with a psychological condition and should not be given any responsibility. And then 6 in 10 believe that mental health conditions are caused by lack of self-discipline and willpower. So still, people have some stigma towards people with psychological condition, but I think it's getting better than as the years goes by, due to the many campaign by our government and by the Institute of Mental Health. So things have definitely improved compared to maybe 10, 20 years ago. So this is an example of what is dysthymia, what is depression. So in dysthymia, it's more low-grade, low mood. So slightly low mood for a number of years. Whereas depression is usually very episodic. They are not episodic, but they are really more severe. They are not always low for 2 years, but you're looking at a period of weeks or months when they are low. Also, this was what I was talking about, the stigma against mental illness, when 9 in 10 feel that they can improve if they wanted to. Now, people with psychological conditions tend not to come forward to seek help due to this stigma. Now, in 2010, for depression, it takes a person about 4 years before they'll come forward to seek help from maybe a doctor or a therapist. But in 2016, that has shortened to 1 year. So this is a really, really good sign that the stigma is getting less. People are more willing to come forward to seek treatment, and they recognize that it's a medical condition. So in terms of treatment, when a patient comes and see me, I will spend about 30 minutes to 1 hour talking to my patient, and then we will find out a bit about the symptoms, the stressor. Of course, I'll go through their background as well, so I can understand them better. So maybe ask them like how many family members they have, what's their educational level, who are they staying with, how their relationship with their partners, how many children they have, etc., etc. So within 60 minutes, I will be able to have what we call a formulation, like what's the diagnosis, what are the causes, what's making things worse right now, what is helping the patient right now. So when it comes to treatment, like I mentioned, sometimes if necessary, I will do a blood test, I will do a physical exam if necessary. And then we will come to treatment where we usually will treat from the biopsychosocial perspective. So medication, therapy, and social intervention. What can we do to help the patient in terms of the family, in terms of work? Sometimes they need prolonged MC. Sometimes they need a medical report or a memo to the company. I have some army boys that are coping very poorly. They do need a medical report and a memo to their camp medical officer and to their officer to explain their circumstances, and then the camp will be able to help. Well, these are just some examples. So in the hospital, we don't work alone. We do work as a team to help our patients. Every Friday morning in my department, actually, we will go through the cases that are difficult, meaning they are not really getting better. Then the psychiatrists, the nurses, the therapists, we all put our brains together to see how we can help our patient. This is at Sengkang General Hospital. There is a medication counter where the pharmacist will actually explain the medication in a lot of details to the patient. Of course, in other clinics where there's only a doctor around, the doctor will also take a lot of time to explain the medication very carefully to the patient. Even today, I think there are some people who are more keen for medication, but at the same time, there are people who are not very keen for medication. So our patients are always in the driving seat. We let them decide if they want to take medication or not, or they want to try other ways to get better. Because this is not a lecture for doctors, I will not go into a lot of details about medication. Suffice to say, there are many different kinds of medication. So a doctor will worry about the medication for the patient and try to choose the best one for the patient. Also, again, a lot of graph and to inform the doctor which are the ones that they can consider. So not the purpose today to really go into so much details. So a bit about antidepressant. Now, antidepressants, these are a pamphlet that I'll give to my patient. They're actually medicine to increase the brain messenger in our brain to kind of rebalance them back to the normal level. Now, it's really good for depression, and generally they will get better after taking it for 2 to 4 weeks. So it's not like they take today, then tomorrow they want to go dancing already. It's not ecstasy. It's not going to work like that. So they do have to continue taking the medicine for a number of weeks before they get better. Now, medications are not addictive. If a person on medication forget to take the medicine, they're not going to get craving for medication. So it's not like opium, or heroin. You're not going to get addicted to antidepressants. Or it's not even like coffee. So when a person is better, they have to continue taking for a period of at least 6 months, then they can stop. So it's not a lifelong medication, although sometimes it is, especially people with very severe depression, or every time they stop medicine, after a few months, the depression come back, then they might have to take for 2 years. But most of the time, after 6 months, we consider stopping the medication already. The medicine are very safe. There are very few side effects, but some people do feel a bit sleepy after taking it. Some people may have some stomach discomfort, as with all medicine, right? I mean, even Panadol after taking some will get stomach discomfort. It does have an unusual side effect where after taking the medicine, they will lose their libido. So a lot of men don't quite like to take antidepressant. So for those that don't want to consider medication, we will then consider therapy. So if a person continue taking the medicine for at least 6 months before they stop, then the chance of relapse is lower. So those that take medication and stop immediately after they get well, the chance of relapse is 50%. So if they maintain for 6 months, then they stop, then the chance of relapse is actually 23%. So it's better to just finish 6 months than stop the medication. Don't stop immediately. So this is an example of what people think when they come to see me. They will think that I'll sit them on the couch and then ask them to talk to me about their childhood problems. But no, it's really no different from a normal consult room with any doctor. Like it's almost like a GP practice. Just come in and I'm just going to ask you like, how are you feeling? What can I do for you today? Just like when you go and see your medical family doctor around your neighborhood. So the whole process takes about 30 to 60 minutes. Now, for people who do not want to take medication at all, we will consider therapy. Or some people want both medication and therapy. So there's a series of therapies that there are many different types of therapies that are very helpful for depression. From a very simple one, like just relaxation techniques, to managing their activity level. So sometimes just by being on the move, getting out of the house, going for exercises can help with depression. Then there are more advanced techniques like acceptance and commitment therapy, cognitive behavioral therapy, mindfulness-based cognitive therapy that the doctor can do, or sometimes the doctor will refer the person to a psychologist or therapist to do the therapy. This day and age, we also do a lot of video consultation already. So because of COVID, all of us are encouraged to stay at home. So some of my patients, they don't want to come down to my clinic. We can just do video consult. I think it's really the best for psychiatry. even easier for psychiatry, because most of the time I just have to talk to the patient. I'm not like a surgeon, right? I have to examine the abdomen. So video consult is really quite ideal for psychological condition. And some of my patients find that it's very helpful. They are working, they just need to find a meeting room and then log in for about 30 minutes to chit chat with me. And I can continue to prescribe the medicine. Medicine will be delivered to their home. They can also do therapy through video conferencing. So some of my patients really don't want to take medicine and don't want to go for therapy, or they are already taking medicine and already going for therapy. So often they ask me, what else can I do for myself? The standard advice for all medical conditions applies, like having a proper diet, making sure that they eat adequate vegetables and protein. Now, in particular, fish or even omega-3 fatty acids, those omega-3 pills that you buy from the pharmacy, these do have some limited evidence that they can help with depression. So I always tell my patients to go and buy the omega-3 fish oil to eat. Regular exercise is very helpful as well. Making sure that they sleep well, proper sleep, at least 6 hours a day, can be very good for our mood. And getting out of the house, exercising. One more thing that is very important is to really look for people who are good for us when we are feeling down. When you're feeling down, do go and talk to your good friends. Do go and talk to people who love you. And it is very helpful for our emotions when we are surrounded by people who care a lot for us. Also seek out people that cares a lot for you. If you don't have anybody that loves you or care for you, it's also okay. You come and find me and your therapist. We will be very kind and loving towards you. Yeah, so these are very standard advice. I think this is something that people can do. Although a lot of my depressed patients find it very hard to do many of this when their mood is really low. Like they will tell me that they find it very hard to get out of the house, exercise when their mood is very low. So it's a bit of a chicken and egg thing, and I kind of encourage them, if they can even go out for 5 minutes, that's really go downstairs for just 5 minutes, better than nothing. Yeah, it will help in the mood. So these are the things that I talked about just now, eating well, sleeping well, exercising, connecting with others. Sometimes I do tell my patients to do a gratitude journal, like at night, do write down some of the things that that they can be grateful for. Because when we are depressed, very often we have very negative thinking. Like we just think that nobody loves us or nobody wants to understand us. So one exercise that everybody here can do is before you sleep, after you close your eyes and you're about to fall asleep, just think of 3 things that happened today that you can be happy about. Just 3 very simple things. Like for today, I had a good night's sleep, so that's one good thing for me already. The second good thing was I had chicken rice for lunch, and the hawker gave me a lot of chicken. So that's the second good thing. Maybe because he knows me. Yeah. So the good thing could be I'm giving this talk today to all of you. So yeah, 3 simple things that really that are really very simple things, but if you have a gratitude journal, then it sets your mind in the right mindset as well. So those that are tuning in to Brahm Center, I presume that you have some inclination towards mindfulness. Good news, mindfulness does have a lot of evidence for managing depression as well, both in the treatment as well as in the prevention of depression. So for those of you in the audience or you have family members that have depression or have recovered from depression, do sign up for some of the courses at Brahm Center, like the MBSR course, the mindfulness-based stress reduction course. They do have really good evidence for preventing or reducing the risk of relapse. I do use a lot of mindfulness technique in my patients if they are inclined towards it. So surrounding ourselves with happy people, these are my colleagues, ex-colleagues. They are both actually aesthetic doctors now, but I use their picture because they have a very happy smile. Yeah, so this is some advice for people who are living with someone with psychological condition. I know it can be very frustrating when your loved ones are always feeling very down, or they get angry very easily, or they just don't feel like eating or don't feel like sharing. So it can be very stressful for people living with someone with psychological condition. So these are some advice that you can consider. Be empathetic, don't try to offer solutions, just try and listen, be supportive. Ask them how they want to be supported. For instance, they might say, "Oh, I hope that you can go for a walk with me." And if we have the time, then let's do it. It can be very helpful for the person who is suffering from depression. Try to do activities together with them, like cooking together or just watching TV together. Some this day and age, all of us are in our own bedroom, glued to our handphone, watching different programs, right? So if you know someone needs your company, just go out to the living room with that person, switch on the TV and watch together. That's and maybe it's just for 15 to 20 minutes. It does make a very big difference. Or just have your dinner when your loved one is watching TV. Spend that time with them. Don't eat by yourself. Don't go out and eat. That 20 minutes can mean a lot to the other person. So give a lot of love and positive encouragement. Of course, look after yourself as well. Always spend some time doing things that you like. Always give yourself some time to exercise, some time to meet up with your friends. Just because our loved one has a psychological condition or any other medical condition doesn't mean we have to devote 24/7 of our time to them. If that's the case, then our battery will be depleted. So do spend some time by yourself doing things that you like to recharge yourself as well, so you have more battery for your loved ones. This is ECT machine. This is an electroconvulsive therapy machine. Most of the major hospitals in Singapore, including my hospital, we do have this machine where we actually induce electric current to the brain to kind of modulate the brain messengers. Now, it is a very old-fashioned way, but it works really well. It's superior to either medication. It's also superior to therapy. So it's really for the very severe case. For instance, they are not eating, they are not drinking water. Then sometimes we will immediately consider ECT. We admit the patient and consider ECT. It really turn things around very, very quickly. Or the patient has tried several types of medication, or have gone for several sessions of therapy, but nothing seems to be improving. Then we can consider electroconvulsive therapy. It's very safe. It's done in the operating theatre. Anesthetist will put the patient under anesthesia. We only apply the current for about a second. After an hour, the patient can go back to the ward already. So it's a really very safe treatment, very effective treatment, really good, but we usually save it for the more severe cases. So for those of you who need more advice, my name is Victor. You're always welcome to Google, and you're welcome to seek my help. I'll be happy to offer my expertise and my care towards you.